Hey guys, welcome to my channel. My name is Dr. Rebecca Johnson, and thank you for tuning in today. I am a physician, a resident physician to be specific. Specialty is psychiatry. It's been incredibly interesting to be a physician, especially a new physician in the middle of a pandemic. You know, I had many a moments over the last year where I really asked myself, like, man, medicine really? I mean, it's a little bit too late, to be quite honest. To be fair, it's a bit too late. You know, we're about to get thrown into the deep end where we are, you know, kind of practicing and learning how to be a doctor on, you know, one day, and the span of the next day, you're the doctor now, and this is what you trained for, this is what you signed up for. Yeah, like in your head, you know, like that's a thing, like that can happen, you know, it's a possibility, it's a potential, but like, is it really gonna happen? Like, no. What if you get sick? What if you get COVID? I couldn't see my family, couldn't see my friends. I was tired and over medicine. So I was just like, what is sustaining me? Like, what is giving me joy? Hey guys, welcome to my channel. My name is Dr. Rebecca Johnson, and thank you for tuning in today. So I thought I would just sort of like get on here and just kind of chat. I don't have a specific agenda. I do have sort of a little bit of some things I want to talk about, but like no specific goals or agenda. I am a physician, a resident physician to be specific. And if you don't know what that means, a resident physician is someone who has finished medical school. I graduated from med school about a year and a half ago. So finished medical school, but you are now in training to become a certain type of physician. So you're training for your specific specialty, and my specialty is psychiatry. So I have been training in psychiatry for the last year and a half, and I just finished my intern year about a week and a half ago, and started my second year. And I thought it was kind of like, sort of like an interesting inflection point, an interesting place to be right now. I have a lot of thoughts about my intern year. I have a lot of thoughts about the second, my upcoming second year. I also have a lot of thoughts about just the last year in general. You know, it's been a fairly rough one for a lot of people. It's been incredibly interesting to be a physician, especially a new physician in the middle of a pandemic. I learned a lot about myself. I learned a lot about, some things that I didn't even want to learn about myself. I learned that happened for a lot of people. COVID kind of forced us all to reevaluate ourselves and our lives, and what we're doing with our lives first of all. And that happened a lot for me too. I had many a moments over the last year where I really asked myself, like, man, medicine really? Like, is this really what you want to do? Like, I mean, it's a little bit too late, to be quite honest. To be fair, it's a bit too late. We're in it. We're in residency. We signed up for this. We're also in a lot of debt. We're also in a lot of debt from medical school. We paid a lot. So it's a little bit hard to be like, oh, let's turn around now. And I say that in a kidding way, but also in a serious way. It's been a challenging year. So I thought this would be a good time to just come on and reflect and just chat and talk and get to know each other. Thank you, for tuning in. If you're interested, I would appreciate if you continue to watch the video. Please, subscribe if any of this is interesting to you. Please, leave your comments in the comment section. Share what you've learned over the last year in COVID, what you've learned about yourself, or just, how your week is going. Yeah. And, this is a new channel, just started today, and it's a new endeavor for me. I think it's something that COVID has really sort of pushed me into. It's something that I've been thinking about a lot for a while, definitely pre-COVID. I've been thinking about ways to kind of get back to myself a little bit. I'm in medicine, and a lot of people in medicine are kind of science people, but not everyone is a science person. I have to be a science person to some degree to be in medicine, but I'm also really into sort of creative endeavors, and I've been thinking a lot about how to get back to doing things that are creative and things that are a little bit more natural and enjoyable for me. And this was one of the ways that I was thinking of doing it. And to be quite honest, a lot of fear has held me back. This has been one of the things that I sort of got out of COVID, was just this sort of necessity to stop putting things off. I feel like I have gotten into the habit of just putting things off. I've been thinking about starting a YouTube channel or doing things that are more creative probably for the last year and a half, and I've just been sitting on it and not really doing it. And so that's one of the things that really came up for me during COVID was, what ways can I really push myself, drive myself out of my comfort zone, stop procrastinating. There goes a word, is procrastinating. I never used to be a procrastinator. And over the last 3 years, I've become incredibly bad at procrastinating. It is just becoming such an intolerable habit that I now have. Just procrastinating, sitting on things, sitting on my couch. And some of that has to do with being burnt out. I think working in medicine and sort of the constant cog has really burnt me out over the last, couple of years. And so I've, started to procrastinate, which is not really in my nature. So yeah, today, this was kind of, it's not fair to say it was a spontaneous spur of the moment, because obviously, I, had thought in advance about it, bought the camera, lights, set up everything. But to be honest, I've had all of these things probably for the last 2 months, and I've just been sitting on it, and been very nervous about starting and making up excuses and all of those things. And today I was just sort of sitting on my couch. I came back from work a little bit early, and I was just sitting at my couch, and I was like, Rebecca, it's time. You need to get up and just do it, And so here I am. I'm getting up and I'm doing it, and I'm pushing myself out of that sort of comfort zone. So sending up a little prayer to God that everything goes well, and, wish me luck. But yeah, so let's get back into it. So, like I was saying earlier, it's been a bit of a year. I graduated from med school about a year and a half ago in March of 2020, really at the height of the pandemic. And it's a little bit interesting, I guess, the sequence of events. And I think this is not, necessarily, if you're not someone in medicine, this might not be something that you're as familiar with, sort of just the timeline of med school and medicine. But, I think like many people, that March, April, May period was a pretty significant time, in my life personally. I know it was for a lot of other people who had things like weddings coming up or school graduations, or, it was sort of like a marking point. I was in my 4th and final year of medical school. So by March, I had applied for residency. I had gone to all of my my residency interviews, and I had been incredibly blessed. I interviewed to a lot of programs around the country, and we had gone through, and submitted our rank list. And the rank list is essentially where you rank all of the programs that you interviewed at from your most favorite program, so where you want to train, to your least favorite program. So I had, submitted my rank list at that point, and we were just getting towards the point of match day, and match day is a huge day for anyone in medicine. Match day is the day that you figure out where you matched. You figure out where you're going to be spending the next like 3 to 7 years of your life, depending on what specialty that you apply to. And it's a huge deal. You might have to be moving to a different state, going somewhere new. So it's an incredibly big day. And that day is towards the end of March, so we were just sort of gearing up for it. I hadn't really, I don't think, heard that much about the pandemic leading up to it. And I think sort of towards the end of February, start of March, things sort of started to bubble up and percolate. And words like COVID and coronavirus and all of that stuff was kind of coming up, and didn't really know what that was, to be quite honest. I think even us in medicine, we're like, what is this? And to some degree, I definitely had my filters on. I was very like laser focused on finishing, 4th year, and looking forward to residency and match day, and starting to plan like my graduation party and my vacation after I graduated. Those were my priorities at that point, to be honest. I had a few med school rotations left, but just sort of like checking the box at that point. And then all of a sudden, out of nowhere, it felt like COVID went from like non-existent to like a million in a day, or like in the course of like a week, really. It's like this thing no one knew about, and suddenly everyone was talking about it. Everyone was freaking out. And we in the medical field were just starting to hear about it. Then, you start looking at things in the news. And it was really getting to this like huge inflection point where it was just like, what is going on? And, fortunately or unfortunately, I think unfortunately, where it really became real, or, the magnitude of it really became a thing, is when things started getting canceled or postponed. That's where I think it really took kind of a huge turn for most people, is when things started to get pushed off. And for me personally, that was when we started hearing, all these conversations about like, is match day going to happen? Is match day going to be in person? Is match day not going to be in person? And like words like virtual started coming up, and it was kind of a freak out point. And it might sound a little bit selfish, but because like, people were dying from the pandemic, from COVID, from coronavirus. Like people were dying, people were suffering. And I think for me, like in a selfish way, I was just like, wow, like match day is canceled. Like what? And that sounds terrible, but I think for someone who, like this is all your life has really been about for the last 4 years, going through med school and studying. And, I had attended every single match day for the last, 5 years, attended to celebrate my colleagues, my classmates, people. Just the year before, I had attended the match day of my actual classmates, because I took a year off. So I was supposed to graduate in 2019, and then I took a year off. So I had just gone to the match day with my classmates the year before and celebrated their match day, and, and their success and their happiness. And so it was incredibly crushing, incredibly sad, knowing that, that the match day that I had always dreamed of or imagined in my head, that it wasn't going to happen the way that I had looked forward to it happening. And that was, incredibly sad, and at the same time, a lot of other people were going through similar things, people who had planned weddings, people who had big life events that were coming up, that were incredibly changed. And so, match day came and went. It was virtual. We're able to, celebrate it in a small way with my family and with my roommate. And then pretty quickly after that, things took an even more significant turn. Early in the video, I said I graduated from medical school in March, which is true, but that's not when I was supposed to graduate from medical school. I was supposed to graduate from medical school in May of 2020. But really, I think the next day or a few days after match day, we started hearing these conversations about, our school is thinking of graduating us early, because things were really starting to hit the fan with COVID. We were going through the first surge, and there was, some thinking that things were just going to get worse and snowball. And, there were some questions about whether medical field, had enough capacity to meet the needs. And so my medical school, was really, and, I went to a state medical school, so even more so, the thinking around what are the state's needs around this pandemic, and how can the medical school really help optimize that. And that was, it was needed, but it was also, as someone who was in fourth year of medical school, just graduating, new physician, or just about to be a new physician, that was frightening. That was incredibly frightening. Like the prospect of really I don't want to say being thrown in the deep end, but I think for many of us, that's what we were thinking about. Like, oh my God, we're about to get thrown into the deep end, where we are, kind of practicing and learning how to be a doctor on, one day, and the span of the next day, you're the doctor now, and you're being supervised, but you're expected to know how to do things and to really get the ground running. And residency is kind of really usually when you start your intern year, it's a gradual build up, gradual build up of responsibility. You're getting trained in how to do things, and now you're being thrown into the situation where there's no time to do that, no time to take your time to learn, take your time to figure out what to do. And so that was frightening. And hearing about, what was going on in the hospitals, because at that point, most medical schools had pulled their students out of the clinical setting, so we weren't in the clinical setting, so a lot of what we were hearing about what was going on, we were hearing from our, colleagues, or from our teachers, I should say, from faculty members, people who were, already physicians in the field. A lot of what we were hearing from the news, and it was incredibly frightening, hearing about things like, there not being enough PPEs, hearing about trainees, resident physicians who were getting sick, who were getting COVID, hearing about physicians or nurses who were dying. And the thing that was really challenging for me personally, and I know for a lot of people, was this idea of, this is what you trained for, this is what you went into medical school for. There was a lot of this rhetoric around heroes, physician heroes, nurse heroes, healthcare heroes. There was a lot of rhetoric around that, and a lot of this we just need to get in there and do it. And like, this is what you trained for, this is what you signed up for, this is what you're here to do. And that was really hard to sit with. That was incredibly challenging to sit with, because on one hand, like, yes, this is what we went to medical school for, this is what we trained for, but to have it kind of hit you in the face so instantaneously, so hard, like, this is, and like, I don't know that that's exactly true, that this is what you went into med school for, because like, I don't think anyone in their wildest imaginations like thought about serving in medicine in a pandemic. Like, yeah, like in your head, like that's a thing, like that can happen, it's a possibility, it's a potential, but like, is it really gonna happen? Like, no, it's not really gonna happen. Like, no one really in their wildest dreams thought like there was going to be a pandemic and like people would be quarantining and there would be stay-at-home orders. Like, that was not in anyone's like wildest imagination. And like, in nowhere really in like my thinking about going to med school or training was I like, yeah, I am going to have to put my life on the line, like day in, day out, for an extended period of time. Because like, mind you, like, no one knew how long the pandemic was going to last. Like, no one knew, was this going to be over like tomorrow, next week, or was this going to be like months, and as we were looking at the science coming out and the projections about like how long this could possibly last, like, that was frightening. That was incredibly frightening, And so like, that rhetoric, that like hero rhetoric, was really hard for people to sit with, because, we were expected to go in to work, to go in to see patients, to treat patients, and then to go home, like as if we didn't have the same risks that everyone else had, because everyone else was staying at home, working from home. But, the essential personnel, the healthcare workers, were expected to go home, to go to work, to put in these hours, to put our lives at risk, and then go home, but it's like we're going home to our families. We're taking the same risks that are, that other people are, being asked to or being expected to take. Like, you go to work and, you see patients, like, yes, hopefully there's PPE, but maybe there's not, or the PPE that there is, there might not be adequate. What if you get sick? What if you get COVID? And then you have to go home and like maybe expose your families, your kids, your parents to this. I think at some point, in those stages from that March to June period, people in healthcare really got upset, really got upset. Like, no one wanted to be called, like, we didn't want to be called a hero, because like, we were scared, we were frightened, about the risks that we had to take, about, the sacrifices that we had to make. We were frightened. We were frightened. And like, it was incredibly scary. And like, by the time that, and like, this is sort of skipping all over the place, but by the time that I, started residency and, really got into the field, like, some things were figured out by that time, like, PPEs and, was a little bit more streamlined, like there was more access to things, policies were in place, there was a slightly better understanding of like the virus and how to treat it, and the mechanisms that we had in place. But I can only sort of like imagine and think back to those like early weeks and days, when like people were just wearing surgical masks, and there wasn't enough PPEs, like there wasn't enough N95s, goggles, things like that. Like, the emergency room at those points was must have been incredibly insane. Must have been incredibly insane. Like, I can only imagine what that was like. I can only imagine what that was like. And so, like, fast forward to when I then started my intern year, that, like, it was really, really scary. It was really, really scary, like, wondering, you know, am I going to be okay? I had already sort of made the plan that, I wasn't going to see my family. I was going to go home and see my mom, for a couple of months until things really sort of got figured out. I moved for residency. And, that was a whole sort of stressor in itself, and maybe something else for a different conversation. But started residency, and my first couple of months I was in psychiatry. I was on the inpatient, psychiatric unit, and then a few months after that, I transitioned from, doing psychiatry to spending some months in medicine, and those months were incredibly tough. Not just because of the long hours that you were putting in, but because of just like what you were seeing, like people were sick, very, very sick. And, we all hear about like the sequelae, or the long-term sort of consequences or complications of COVID, but to kind of see it right in front of your eyes was incredibly challenging. Being there, being present every day, and you're getting to see some of like the consequences and the complications of COVID, and having patients who are in the ICU and then transferred out from the ICU into the regular medical floor, who have been, on intubation or intubated for weeks on end, or, you see them and they're literally like struggling to just breathe, to just get enough air into their lungs, like to the point that breathing hurts. Like that, like there's this term in medicine known as air hunger, where it's just like your body, your lungs is just hungry for air. Like you're not getting in enough of the air that you need. And that, as I can only imagine like feeling that, and how absolutely like devastating and distressing and frightening and scary like that feeling must be for the patient. There were several times I would walk out of a patient's room and just like have to hold back myself from like crying, because you just felt so sad, and like you knew, especially with patients who were already in the ICU, they were already like intubated for weeks and weeks and weeks, and now they're out of the ICU, but they're having this like significant air hunger, or like you look at their x-ray or their CT scan really, and you look at their lungs and you just look at how absolutely destroyed their lungs were, because that's what COVID, did or does. It just destroys your lungs. And you just know that like there's no way that person's gonna do well long term. Like even if they make it out of the hospital, like their quality of life, is just probably not gonna be that great, and to talk to families. And that was the other thing that was incredibly difficult, is knowing that, you have these patients who are sometimes dying, sometimes incredibly sick, and they're in the hospital by themselves. Their families can't come and visit, so like you're looking at it from the patient standpoint, where you're like, they're going through this incredibly terrible thing alone. And then you're looking at it from the family standpoint, where, like we, the healthcare team, were their only real connection. Like, yeah, they can talk to their family members, but like sometimes, the patients are they're not really like able to communicate, they're not doing well enough that they're able to communicate, or if they're in the ICU, they're on the ventilator, or they're intubated, and you're like their only source of communication, or their only source of knowing what's happening with their family member who could actively be like dying, and that on top of it just added this like layer of sadness. And the thing that was especially sad for me, I think that a lot of people who go into medicine, like you're going into it for, I don't know if like human interaction or human connection is the right way of explaining it, but like, a lot of people go into it for this like altruism, you want to help people, you want to take care of people, you want to help people get better and not be sick anymore and to look after their health. And now you're forced into this situation where you feel like for your own well-being and for your own survival and for your own health, like you kind of have to put a separation between you and the patient, like you would go into the patient's room fully like covered up, you have your gown, you have your N95, you have your, your goggles on, you're like really trying to protect yourself as much as possible. The patient has no clue what you look like, you're just sort of like a voice in a body that's coming into the room to see them every day. And from the healthcare provider standpoint, you're trying to, assess the patient as quickly as possible and get out of that room as quickly as possible to be able to reduce your exposure. In those early stages, we would have to, go into the room, see the patient like as quickly as possible, or try to see the patient as quickly as possible, do the physical exam, ask all the questions that you needed to, and then like get out of the room as soon as possible. And then like you would call the patient, outside of the room, call the patient to try to, get the rest of the information that you needed or ask the remaining questions, which was crazy, because many of us, like I was saying earlier, like we went into medicine because we wanted to help people, because we wanted to treat people, for these like quote unquote like altruistic reasons. And now you're kind of faced in a situation where you can't do any of that. And there's this like weird, I don't want to say like conflict of interest, but like you're constantly negotiating, like worrying about yourself, worrying about your family, worrying about your own health. And then like this other part where you're just like, am I really doing right by this patient? Am I taking care of this patient as well as I could be? Like you're thinking about this patient is in this room. They're like locked, not like they're locked in the room, because like we don't lock the room, but like because of the COVID and the procedures, like the patients couldn't leave their room. They couldn't go on walks. They couldn't walk down the hallway. Like you had to stay in your room. And if you were a COVID patient, the amount of people who would be coming in and out of the room, to talk with you, to chat with you was really limited, because everyone, was trying to do their best, trying to take care of the patients, but also trying to take care of themselves and protect themselves and make sure that then when they go home, that they're then not, exposing their family and their loved ones to COVID essentially, which was incredibly difficult to do. So many times, like you would call patients and, call patients' families and have to, whether it's deliver bad news or have to talk about, how their family members are doing. And, they would sort of, they would be looking for this sort of like reassurance, and you had to be this like bridge while also knowing that, you were spending not as much time with the patient. And I can't imagine like it was any easier for the nursing staff, because they would often, they're probably, seeing the patients a lot more often throughout the day than we would, just because of our case volume and our caseload. But they're in the rooms more often, checking on the patients more. They have to go give the meds and like do all of these things. So I can only imagine like how much nurses had to deal with, and how much, like phlebotomists and technicians and other sort of support staff, like how much they had to deal with. It was just a very, very trying, very, very challenging time to be in medicine. And then like the crazy thing too, you had so many physicians, like seasoned physicians, who were totally thrown left field, like completely out of their comfort zone. Can you imagine, like, because I think, if you're not in if you're not in medicine, you may kind of think that like skills and knowledge is super interchangeable. And, in some ways it is. Like, we all, as physicians, went to med school, we all graduated, we've all done residency. But if you are like 10 years into your practice, of whatever specialty that you're doing, like let's say you're a surgeon, or you're, in ortho, or you're in ophthalmology, or you're in I don't know, like you're in something that is not internal medicine, or even like pediatricians or psychiatrists, like you're in something that is not general medicine, and now there's this huge pandemic, this huge issue going on, and you're being asked to sort of you're being asked to take on this new role, doing something that you haven't had to do in a long time, exercising muscles that you haven't had to exercise in a long time, practicing with knowledge that you haven't had to use in a long time. Like, a lot of medicine is practice, is rehearsal. Like, you have to do something over and over and over again until it just becomes second nature. And no matter how smart you are, like if you haven't had to pull out a certain, knowledge or a certain piece of information in a long time, like there's no way that you're going to be as comfortable, with that knowledge or with that information. So you had like surgeons, who were being asked to cover like medical, internal medicine units or medical floors, who were just like, what the heck? Like, I haven't done this in so long. I don't know what the heck I'm doing. And you had like psychiatrists, like all of those, like people who weren't internal medicine specialists being asked to do internal medicine. So many people had to kind of go back to the drawing board and like restudy and relearn, things that they haven't had to use for a long time, and I think like as a new physician, like we're a little bit closer to medical school, so maybe that was a little bit like easier for us to do. But I can only imagine like the physicians who had to do that. And then even more so, there were physicians who had to make really, really difficult decisions about whether or not they could continue to practice through the pandemic. It's, because we always say, the most vulnerable, patient populations for whom, COVID is the most dangerous. Like, those populations also exist in medicine. Like, you have physicians who are older physicians, who are elderly, who have like comorbid conditions, or who have, who are immunocompromised. They have, they're like the same concerns that existed in the general population also existed in the physician population or the healthcare worker population. So you had people who were also kind of put in this like between like a rock and a hard place, where it's like, there's a need. Do I go and try to help, with this need, knowing that by doing so, I am putting myself at an incredible risk, so that was just so challenging, so challenging. And so it was just a hard year. It was a hard year for so many people. And then thinking back, I guess how it impacted my, intern year was just I think there's so many things and so many expectations that you have of your intern year, what it's going to be like, that it's just, it's just like we had to be flexible in so many ways. For my class, like so, so many other people had this like great, so like you're dealing with this really sad thing, with the pandemic, but then at the same time, you also feel this great sense of loss, in terms of just like your career and your development, because, so many milestones in this time period were really had to be changed and adjusted, and some were lost, like, match day, the graduation, my graduation happened over Zoom, and it's still, I still can't believe it. I remember the day I graduated, I made a Facebook post and I was like, I can't believe I just graduated over Zoom, and, back at that time, that was like a statement that was like, it was new, it was different, as the pandemic sort of went on and months, that just became like commonplace to just do so many things over Zoom, that just became commonplace. So like losing that, losing being able to walk across the stage for this thing that, I have painstakingly worked my butt off over for the last like 5 years, lost nights, staying up all night studying, crying over like tests that you may not have done as well on as you wanted to, suffering through the step exams, doing all of these things, and like you're looking forward to your like hurrah moment and your victory and your celebration and like walking across the stage, and then it comes to that point and it's just like ripped out from under you, which was like, I think like I'm like smiling about it. Am I smiling? I don't know, but like I think about it now and it's like a little bit easier to deal with, but like thinking about it, like back then, like it was crushing. It was crushing. It was crushing for me. It was crushing for my family. Like my mom had planned we're Nigerian, by the way, so everything is a party. And my mom had planned a huge party, like we were gonna celebrate, and so like that was lost. And then we started like residency, and like I was meeting my co-residents, my co-interns, like in virtual spaces and like not in person. So that like bonding that we would normally do like wasn't a thing. I mean, there are some like highlights and some positive points of that, because to be honest, like, we were amongst the few sort of industries or careers who could go outside, who was going to work, so unlike, some other people who had to be forced, to stay at home to work virtually, like we still were able to go into work. We still were able to have some of that like human interaction on a daily basis, which for me like really made the months more bearable, because I cannot imagine what it would have been like having to stay at home day in and day out, having to stay at home like alone, and not having, that interaction. So as much as like it was a risk, and we couldn't see our family, like that was one of the positive things, is that at least, we had a reason, an excuse, and a permission to sort of leave the house and going to work. So it was a challenging couple of months, and grueling. And at many points, like you kind of felt like you were reaching your breaking point. I think there's something that happens when you're kind of under sort of mental stress from many fronts. Probably by midway through intern year, like I was so burnt out. I was so like ready to be done, so tired, stopped caring, honestly, about anything, like about work. Like it just felt like you were just going through the motions, like trying to survive and just like going through the motions day to day. And it felt sad. everything just felt so sad and felt like you didn't really have anything to like look forward to, because it was just like the same day to day of like, you wake up, you go to work, you like see patients who are dying, not doing well, really, really sick. And then you have to like internalize and deal with all of that. And then like you come home, and you don't have your friends, your family members to kind of, talk to or to spend time with and bond with and sort of like commiserate with in person, and just getting that sort of like human interaction. You just have to compartmentalize, or, to decompress it, or, to deal with it on your own. And then you wake up the next day and you just do it over and over and over and over again. So it got exhausting. It got so exhausting that by the end of it, I was so incredibly ready to be done with intern year. There have been many a times during intern year that I definitely asked myself, like, why the hell am I even in medicine? Like, and I know I was not the only one. There were many, many, many times during this last year where you were just like, why am I even doing this? Like, I'm not happy, I'm not feeling as fulfilled as I thought I would be, and that was just like the really tough thing to sit with, because you finally sort of like arrived at this thing that you've worked so hard for, that you've been looking forward to, and then you just sort of like feel let down by it. So that was a hard space to be in. And really like the only thing that I think got me through, I'm not gonna say the only thing, but one of the key things that really got me through was my co-interns, who were just like an incredible source of support, like knowing that you're all kind of like commiserating and suffering through the same thing, really, really helped. But yeah, I ended my intern year in the ICU, which was almost like ironic, or as if to like, what's the word? I can't think of the word, but like, when like something is so like putting the cherry on top in, but like in the wrong way, in the opposite way, was ending my intern year in the ICU. It was challenging. It was hard. I learned a lot. Like, I honestly was lacking for compassion, I was honestly lacking for compassion, compassion for others, compassion for myself. Like, I was just ready to be done with everything. And I think that's a part of like medicine that maybe we don't always talk a lot about, is like how challenging it is to feel like, like you're just being drawn out of, like your well is just being like depleted, on a daily basis. Like at some point, like that starts to run really dry. And it's like, when that happens, how do you continue to deliver the same sort of compassionate care to patients? Because everyone always, like, you talk about like the science of medicine, but like there's also the art of medicine, and the art of medicine are those things like the bedside manner, the patient's warmth, advocating for your patients. Like, how do you continue to do that, when you just feel so like tapped out and so tired? And honestly, like, that is where I was at the end of my intern year. I was just like, I clock in, I clock out, I'm done. Don't ask me for anything extra. Like, I just want to go home and like not be here. Yeah, so that's kind of how my intern year ended. I learned a lot. I learned a lot about myself, throughout all of that. I learned a lot about like what wakes me up in the morning, and what doesn't wake me up in the morning. I learned a lot about the importance of the importance of having balance, you know, and I feel like that's such an easy thing to say, like having balance, but the importance of like having balance. And because at no point did I feel it more critically than, you know, the fact that all I really had in my life was like friends, medicine, family. At no point did I feel that harder than during COVID, you know, because, you know, you would just like, I would wonder to myself, like, what is sustaining me right now? You know, like I couldn't see my family, couldn't see my friends. I was tired and over medicine. So I was just like, what is sustaining me? Like, what is giving me joy? And I really couldn't think of it. Like, it sounds so whatever to say that, but like, I really couldn't think of what is giving me joy right now, because it just wasn't like, I couldn't, you know, like things like, what are my hobbies? What do I like to do? You know, how do I keep myself busy? You know, how do I find peace? You know, like I realized that like there are not a lot of other things in my life other than like medicine, because literally medicine has been so encompassing. Unfortunately, that's how it is for, you know, physicians, is that medicine becomes so incredibly like all encompassing, and it just like takes over your life, you know, that like you don't even know how to be normal anymore, you know. I remember one of my co-interns said recently, like, as I don't remember what we were doing, but I think we were talking about the pandemic kind of like coming to an end, and being able to now have like social interactions or like hang out with people. And she was just like, how do you even like hang out with people? How do you make plans? Like, how do you have social interactions? Because like, I don't know how to do that anymore, you know? And I think like in her case, she was talking about that like within the context of like the pandemic, but I feel like it's even more bigger than that. Like for me, and I think for other people, like in medicine, it's like you think about that in the context of like the last, you know, 5 to 6 years of your life since being in med school. You're just like, what is it like to live and like to adult, and you know, and like that's really what I realized, is that I just did not have a lot going on, you know, other than just like work. And I'm just like, that's not life. That is not life. And so that's one thing that I really like, one area of my life that I was like, man, this is really lacking. Like, what are you going to do about this? You know? And that's where, you know, I had to really kind of reflect and remind myself of who I used to be, or like how I used to be, you know. Usually I'm someone who's doing a bajillion million things at once, you know, exploring different things, hobbies, all of that. And I just sort of like let that go to the wayside because of, you know, the journey that I was on in medicine. And so this last year, and sort of going through the pandemic, sort of really challenged me, and brought to the top for me, you know, the importance of adding things of value and quality back to my life, things that I enjoy, things that help me grow myself, you know, because that's what things in our lives are there for, you know. Like if you're just growing in one lane, like you're not a full like actualized human being if you're just growing in one lane. Like you have to be finding ways to grow in multiple different dimensions, and having multiple different types of experiences helps you do that. And I just realized that all I've been growing is my career and work, and really like nothing else. And so that was sort of a big wake up. That was definitely a big wake up, is like, hey, Rebecca, like you need to do something about this, because it's not working. Yeah, so that was I think like one of the biggest takeaways. And I think I also learned that I've gotten into the habit of laziness, you know, or like making excuses for why I'm not living, you know, because for the last like many years, I think I've been telling myself like, oh, when I graduate, you know, once I finish med school, once I, you know, finish residency, then I'm gonna do X, then I'm gonna do Y, you know, using that as an excuse for why I wasn't like pursuing certain things in life, or pursuing, you know, or like, oh, you know, I'm too burnt out, I'm too tired. And it's like all of those things are true. But like, am I really going to not live life and put my life on pause for the next, you know, 8 years? Because that's kind of how long med school and residency takes, for me at least. Like, am I going to put my life on pause for those 8 years and not do anything and not grow and not take advantage of these experiences? No, like, I can't do that. I can't do that. And so that's, you know, one concrete thing that I've really told myself as the pandemic is really, like, by God's grace, starting to wind down, is that I really need to change these habits. Like, I can't keep, you know, using these excuses to not live. Yeah. And so that's kind of where I'm at right now. I'm starting second year. A lot of those challenges are still here. You know, COVID is winding down, but it's not over. There are new challenges of second year that I am currently learning about and currently learning how to deal with. Residency is not over, you know. The demands aren't over. And I'm still learning. I'm learning how to doctor and how to be a doctor, coming into myself and my like professional identity. I'm still learning all of that, and I'm excited for the opportunity to do that in second year. But I'm really sort of like challenging myself to see work as work, you know, and to like to work to live and not to live to work, you know, to see work as sort of like the vehicle that is going to allow me to achieve all of the things that I envision and dream about for my life, as opposed to seeing work as the vision, you know. I think I had been operating sort of as if work was the vision, and I'm challenging myself in the second year to really kind of undo that thinking. So that's where we're at. That is where we're at. I know this is probably going to be a really long video, a really long intro video, by the way. But thanks for sticking through to the end. And I would really love to hear your thoughts on anything that I said. If there's anything that, you know, resonates with you, or that you have a different thought about, you know, please share it in the comment section. I would love to hear about how the coronavirus sort of pandemic went for you, what you learned, good or bad. If you have any, you know, any stories about how it impacted you, your family, that you want to share, I would love to hear about it. If there are any thoughts, you know, any ideas about, you know, what I should talk about in the future. Like I said, this is new for me. This is a new endeavor, new, you know, new experience, new everything. So I am really open to exploring this and every different topic. I guess I should end this by really talking a little bit about like what my interests are. You know, I am passionate about, you know, working with people, about learning about people, learning about what, you know, makes people tick and makes people who they are, which, you know, is kind of why psychiatry is such a great fit for me. I'm interested in learning about cultures and about humans and just why we are who we are and how our experiences really inform our identities. I, you know, am really interested in just like life things. I love to cook. I love sort of interior design. You know, these are the things that I like to do with my time outside of medicine. I love interior design. I like to sing. I like to just like have fun. I'm also really passionate about like young people, about mentoring, and about sort of helping people achieve the things that they want to achieve in life through mentoring. I am very, very passionate about, you know, women, young Black women, Black people in general, and just sort of like growing us as a people and propelling us forward. I am interested in talking about everything in medicine, like whether it's from, you know, what it's like to be sort of in medicine and dating, in medicine and married, so what it's like to be in medicine and having kids, or, you know, what it's like to move for residency, like taking board exams, studying for the MCAT, anything, everything. I am open to talking about it. So if you have any ideas, please leave it in the comment section and please subscribe. You know, I would really appreciate it if you enjoyed this video. If you want to hear about, you know, what I have coming up, how the rest of my year is going to be going, please subscribe. Please, you know, click the like button. And yeah, thanks for joining me. Thanks for tuning in, and I will see you next time. Bye.